Paul in Woodinville, Washington. Hey, Paul, what's on your mind today?
Oh, hi, Tom.
Hey.
Yeah, I wanted to chime in about some of the clips you were playing of JFK in Medicare. Actually, the Medicare bill was written way before that speech. It was written in 1957 by Rhode Island Congressman Amy Forand. And it was scuttled by the Republicans and Eisenhower at the time. They considered it socialized medicine.
Right.
And you may have alluded to this or mentioned it, but they even got Ronald Reagan, the actor at the time, to make
I thought Ronald Reagan's album, I believe I used to have a copy of it. I thought that came out in the 60s.
Saying it was socialized medicine and
right. Someday we'll look back and say we remember a time when men were free, and all that kind of stuff. But wasn't that in 64, 65 when LBJ was pushing Medicare? Isn't that when he did that album?
Yeah, it might have been.
I'm pretty sure.
Might have been then. But what we got before that, in 1960, before JFK took office, was what the pre-runner to Medicare was what was called elder care.
Yeah.
And elder care was kind of like Medicaid for the elderly. It was run by the states. It was very unsuccessful, and it was one of these things that required the elderly to pay.
Right.
Yeah, it was kind of a cross between Medicaid and health savings accounts.
Right.
So the Medicare bill had been in the hopper before JFK made it.
Yeah, although if you look at the history, particularly Robert Ball's involvement with Medicare in the 60s when he was working with Lyndon Johnson when they rewrote Medicare and introduced it, Robert Ball, who was arguably the guy who wrote most of that legislation, at least according to several histories I've read, said on the record that their plan was in the coming decades to progressively lower the entrance age until everybody in the United States was covered. The Medicare was going to be a single-payer system that would cover everybody. And Shano just let me know that the Ronald Reagan album saying that Medicare was socialism was 1961. Just FYI, Paul.
Yeah. Okay. So, and then there was a comprehensive health care plan, as you said, starting with Teddy Roosevelt. There was a real comprehensive one in the 1940s that was led by John Dingell Sr. of Michigan and two others who wrote it, whose names escape me at the moment. And in 1946, Richard Nixon also chimed in with a plan, which he did again when he was president,
right,
which was kind of like what we call Obamacare now. That's true. But one thing I got to tell you about, you played this clip of this Michigan congressman whose kid had a broken arm. Let's look at this. First of all, he says, if you really knew the costs, if the costs were coming back to the customer, the patient, then you might think twice about it. Well, the problem is there are no real costs. That's one of the things that's driving up healthcare costs through the roof. That's the second most important thing is there are no real costs because there are so many payers.
Right.
And we have every payer, every insurance company has a different contract with a given provider. So what it's going to cost you, because you would have a health savings account in conjunction with your health insurance, and you'd have to pay out of that. That's really what you're going to be paying the health insurance.
Right. That's problem one. Problem two is who has money to set aside into a health savings account.
Right.
Right. And it's maybe the top 10%. The top 10% are not the ones that this is designed for.
Exactly. But look what he did. He said, instead of going to the emergency room, look at the savings. So he waited overnight, and just think of somebody who's thinking about the cost of an emergency room visit. With a broken bone, if that bone is not treated within 24 hours, there's a good chance it will not heal properly.
Right.
Then you have to go in and have surgery.
Right.
Think of the cost.
Yeah, and by the way, the younger the child, the more rapidly the bones heal, and so it's entirely possible that if his kid was under 10 years old, even overnight might be enough to start the process of those osteoblasts rebuilding themselves all around. I mean, it starts immediately right after the break.
Right. That happened to my left hand. I broke my hand, and we didn't think it was broken. I didn't tell my mom that I had a broken hand, and about a month later, it broke again, and they actually broke it the rest of the way and reset it. But I have my left hand I have a funny, on my little finger.
Right.
But the thing is that you don't want people triaging themselves or their family they're not qualified to do that based on cost. That's what health insurance is for, to encourage you to go get the service that you need rather than go hemming and hawing over what the costs might be. That is the most insane way to consider how to deal with your health, by saying, oh, this might cost me too much, I better not go.
Well,
because
it also,
people are not qualified. You say,
Paul, I've made this.
Go away.
Yeah, I have made this argument for a long, long time that the Republicans who advocate this sort of thing are probably somewhere on the sociopathy scale. They don't have the ability to empathize with other people, to experience the pain of other people. And therefore, they just think, oh, well, here's the rational, I've figured this out academically, and this is the best thing. And therefore, so what if people are hurting? I don't know what that means, And here he's got a kid with a broken arm. And he's saying, sorry, Sonny, we're going to wait till tomorrow. You don't get any pain. Here, have an aspirin. Well, if it's a serious break or a compound fracture, I mean, that could even cause the kid to start bleeding out. I mean,
he could bleed to death. One more point, if I may, Tom, just quickly. We are getting this idea from the idea of repealing Obamacare. Is we keep hearing that you need more options, you need more choices. In fact, we're getting this with education, too. And the argument is, well, you should be able to choose. Don't you think you should be able to choose more than the government chooses? Of course, theoretically, yeah, you want more choices. The problem is, first of all, it's not a lack of free market options and choices, insurance options, that is causing the skyrocketing of healthcare costs. That's not it at all. The problem is that when you go to choose a healthcare plan or anything, it's who's going to come out on the short end, you or the professional insurance actuary who wrote the plan.
Right.
So there'll be lots of choices out there. They're all set against you. Just like when you walk into a casino, there's all kinds of choices of games to play, and every one of them is set against you to lose.
I love that metaphor.
The idea that you need
May I borrow that, Paul?
It's ridiculous. Yeah.
May I borrow your metaphor?
Absolutely.
Thank you.
That is the whole argument of choice that the Republicans keep pushing, is that you need more choices. What they don't tell you is the choices you will be offered are all set up to screw you.
There you go. Paul, thank you for the call. Your insights are always trenchant, if nothing else. Thank you.